Hello, my name is Bob Doman. I'm the founder and director of the National Association for Child Development. This video is part of a series we're doing relative to children with Down syndrome. Specifically in this video, I'd like to talk about Down syndrome and the correlation between it and sensory dysfunction or autistic tendencies, as many people are now concerned about. The truth is that virtually any child with a developmental issue can develop autistic type behaviors or have tendencies in that direction. The slower the developmental process, the more likely this is to develop and exist. Essentially, if you look at it, all babies do what are typically called now STEM. All right, they rock, they suck their thumb, they feel materials. And this is normal. And what happens with a typical child, however, is that the neurodevelopmental process moves along fairly rapidly, and the brain learns better things to do. Part of what happens if you slow the developmental process down is the brain actually gets too good at things. And rather than moving on, and rather than change becoming the norm for the child, for the brain, staying the same becomes the norm, and it's what the brain wants to do. Essentially, autistic type behaviors are what we refer to as debilitating sensory addictions. Now, I coined this term debilitating sensory addictions, or DSAs, based on the perception and reality of what these things are. Essentially, every time a child learns to stim or get stuck on a behavior, and that can be everything from them waving things in front of their eyes to making repetitious sounds to getting stuck on specific videos to doing anything with any sensory channel. It is a sensory addiction, and essentially what happens when the child engages in those behaviors is they're playing with a sensory channel that's not properly developed. They're continuing to break that sensory channel, and they're becoming addicted to it exactly like a drug addiction. The brain's response is just like it is to a drug. And the reason I call it debilitating is because it is in fact that. If the brain of the child is dedicated, directed to the addictions, it's debilitating. It's going to not only slow down development, it may stop the development, and if left to go unchecked, the child very possibly is going to regress. This is sadly something we see in all too many children. For example, you'll see a history of a child, and the child was doing fairly well, and circumstances occurred such as there was another child comes into the family, mom is sick, they're not able to provide the child with enough input, and the child is left at a developmental point where their processing is not enough, where they can play appropriately, engage appropriately, and these debilitating sensory addictions start growing. And within often months, we have a child who is acting as though they're a full-blown autistic child. So it's important to understand this potential exists in all the children, particularly those children who are neurodevelopmentally below the level of a kind of a typical 3-year-old. Typical 3-year-old is getting to the point where they can engage in appropriate developmental play. They can learn from their play, learn from their investigation, and they're kind of off and running. But until the child hits that developmental level, all the children have the potential to get stuck in these ruts. And the longer they're there, the stronger the addictions become, and the more intervention required to address these addictions and eliminate the addictions. For those children who are in this already, it's important to identify what's broken in each of the sensory channels, to normalize those sensory channels, to keep the child engaged so that they cannot do the stimming behaviors, the debilitating sensory addictions, and simultaneously to build their global neurological function, sequential processing, to that level of a typical 3-year-old, which corresponds with the sequential processing of a 3, and then teach the child how to play appropriately, how to engage themselves appropriately so they don't need the addictive behaviors. Okay, this is an important point. It's also important to understand that your child doesn't suddenly catch a disease, which is autism. All right, it's a developmental problem. Matter of fact, I've been in this work for many, many years. When I first started in working with Down syndrome, we still had the big institutions in the country. And the truth is, if you went into those institutions in the 50s and 60s and early 70s, virtually every child in that institution was functionally autistic. Because simply not having moved far enough developmentally, not receiving enough specific intervention, too much time, downtime on their own, and they develop the addictions. Okay? So this is a real concern, but it's important to understand it's something that can be addressed, something that can be fixed, but we have to look at all the pieces, address all the pieces. Thanks.